Hello, my friends. This is Dr. Mandell with you today. I want to share something very important that most people never think about, especially if you are over 60, you need to pay close attention. There is one simple mistake that millions of people make every single morning, and it can triple your risk of having a stroke. Now, before I tell you what this mistake is, let's understand this. Your body, after a long night of sleep, is in a delicate state. You've been lying flat. Your blood pressure shifts. Your blood can become thicker, and your circulation is not at its best. This is the time of the day when strokes and heart attacks are most common. So what is the mistake? Let's talk about the time of the day when your body is most vulnerable, the morning hours right after you wake up. Now, you may not realize this, but the early morning is considered one of the most dangerous times for your heart and your brain, particularly if you are over the age of 60. Why? Because your body has just gone through several hours of rest and repair, and the balance of fluids, blood pressure, and circulation is not the same as it is during the day. When you're sleeping, you are lying flat. The heart doesn't have to work against gravity as much, and the circulation slows down. Your body loses water throughout the night just through breathing and perspiration. Even if you don't feel it, that means when you wake up, you are slightly dehydrated. And what does dehydration do to your blood? It makes it thicker. Think about honey sitting in a jar. When it's warm and fluid, it moves easily. But if you put it in a cool place, it gets thicker and slower. That's what happens to your blood first thing in the morning. It becomes more concentrated, which makes it harder for your heart to pump it through your arteries. Now combine that with something else. When you're lying down, your blood pressure is balanced differently than when you're standing. As soon as you get up in the morning, your body needs to make an adjustment. Your vessels have to constrict, your heart has to pump harder, and your nervous system has to kick in to stabilize your blood pressure. In younger people, that process happens in seconds, but as we get older, the arteries lose their elasticity, the nervous system doesn't react as quickly, and the heart may not pump as efficiently. This is why the morning becomes such a dangerous window of time for older adults. You've probably heard stories of someone waking up, going to the bathroom, and collapsing. This is not unusual, unfortunately. The medical literature is filled with studies showing that strokes, heart attacks, and sudden cardiac events happen more frequently in the early morning hours. In fact, research shows that the risk of a heart attack is significantly higher between 6 a.m. and noon than at any other time of the day. And strokes, too, are more likely to occur shortly after waking up. Let me explain why strokes in particular are so tied to this early morning danger zone. A stroke happens when blood flow to the brain is interrupted. That can be caused either by a blood clot blocking an artery or by a blood vessel rupturing. When your blood is thicker and stickier in the morning, the chances of clot formation increase. At the same time, blood pressure tends to surge in the morning after lying down all night. When you stand up and start moving, your body releases stress hormones like cortisol and adrenaline. These hormones raise your blood pressure and make your blood vessels constrict. For someone with stiff, aging arteries, that sudden rise in pressure can be enough to trigger a vessel to rupture or push a clot loose, sending it directly to the brain. This is why we say the morning is the danger zone. It's a perfect storm: thickened blood, dehydration, stiffer arteries, higher morning blood pressure, and slower nervous system responses. For those over 60, these changes are even more pronounced. Your vessels are less flexible, your heart may not pump as strongly, and your body doesn't adjust as quickly to pressure changes, so the risk multiplies. But here's something I want you to always remember. Just because mornings are risky does not mean you should live in fear. Knowledge is power, and prevention is everything. By understanding that the first 30-60 minutes after waking are critical, you can take steps to protect yourself and dramatically lower your risk. So what can you do? First, recognize that your body is dehydrated when you wake up before you reach for that cup of coffee or tea, which can dehydrate you even further. Drink a glass of water. That simple act helps thin the blood, improves circulation, and gives your body the fluid it needs to function. It's one of the most powerful habits you can develop. Second, never jump out of bed in a rush. When you wake up, give your body time to adjust. Take a moment to breathe deeply, stretch your arms, and gently roll to your side. Bring your legs over the edge of the bed and sit for 30 seconds to a minute. Allow your circulation to stabilize. This one habit can prevent dizziness, falls, and dangerous drops in blood pressure. Remember, sudden changes in posture can rob your brain of blood flow, and that's the last thing you want when you're already in the danger zone. And third, be mindful of stress in the morning. Many people wake up and immediately rush into their day, checking emails, worrying about schedules, or hurrying out the door. Stress hormones are already higher in the morning. Adding more stress only puts greater strain on your cardiovascular system. Start your day with calmness, gratitude, and a sense of peace. That emotional balance translates into physical balance, lowering your blood pressure and protecting your heart and brain. So my friends, understand this. Mornings are not your enemy. They are simply a time when your body needs extra care. Think of it as driving a car that's been sitting in the cold all night. You don't just slam on the gas and race down the road. You start the engine gently, let it warm up, and give it time before going full speed. Your body works the same way. After a night of rest, you need to ease into the day, giving your circulation, heart, and brain the chance to adjust. If you are over 60, this is especially critical. You've worked hard all your life and you deserve to protect the years ahead. By being mindful of these morning changes, you can lower your risk of stroke, heart attack, and sudden falls. Don't underestimate the power of small habits. A glass of water, a few deep breaths, and a slow transition out of bed. These may seem simple, but they can save your life. Always remember, your health is your wealth. Take care of it every morning and it will take care of you for many years to come. I want to share something with you that many people overlook, and it can literally be the difference between staying healthy or ending up in the hospital. The mistake is so common, and most of us are guilty of it, especially as we get older. That mistake is jumping out of bed too quickly in the morning. Now, I know this may sound simple, maybe even harmless, but let me tell you, it is one of the most dangerous habits for anyone over 60, and it can actually triple your risk of stroke. Let's walk through what happens when you wake up. You've been lying down for 6, 7, maybe 8 hours. Your body has been at rest. Gravity hasn't been pulling your blood down into your legs because you've been horizontal. Your blood pressure has been balanced in a completely different way. The moment you sit up or stand, your body suddenly has to fight against gravity. The blood that was evenly distributed now starts pooling down in your lower body, and your brain, which needs a constant supply of oxygen, is at risk of being deprived. Now here's the problem. In younger years, your body has an amazing system that reacts almost instantly. It tightens the blood vessels, raises the heart rate slightly, and keeps blood flowing to the brain. That's why young people can pop out of bed, run down the stairs, and not even think about it. But once we reach our 50s, 60s, and beyond, that system doesn't react as fast. The arteries are stiffer, the nervous system is slower, and the heart doesn't pump quite as strong. The result, a sudden and dangerous drop in blood pressure when you get up too quickly. This is called orthostatic hypotension. When your blood pressure drops, the brain doesn't get enough oxygen. That's when people feel dizzy, lightheaded, or like the room is spinning. Some may even faint. But here's the real danger. That drop in pressure combined with thicker morning blood can trigger a stroke. If you already have narrowing in your arteries, if there are plaques sitting on the walls, that sudden rush or drop in blood flow can loosen a clot or cause a blockage to form. And if that clot travels to the brain, it can cut off circulation in seconds. That's a stroke, my friends. I want you to think about how common this mistake is. How many people do you know who jump out of bed because the alarm clock rings, or they need to run to the bathroom, or they have to start the day in a hurry? They don't even stop to think about what's happening inside their body. And sadly, this is why so many strokes, heart attacks, and sudden collapses happen right after waking up. We look at these events as out of the blue, but in reality, there are often simple habits that set the stage for them. So what should you do instead? The answer is simple. Respect your body's need to adjust. When you wake up, don't be in a rush. The world will wait for you. Take a few deep breaths while you're lying in bed. Feel your lungs expand. Get oxygen moving through your system. Then instead of sitting up quickly, roll to your side first. This gentle movement allows your circulation to shift more naturally. Bring your legs over the edge of the bed and sit up slowly. Stay there for half a minute to a full minute. Let your body catch up. Let your blood pressure stabilize. Only then should you stand up, and even then do it gradually. This simple routine can save you from dizziness, falls, or something far worse. I've seen countless people who suffer injuries just because they stood up too quickly, broken hips, fractured wrists, head trauma. But beyond that, this one habit of jumping up in the morning has been linked to serious vascular events. By slowing down, you're giving your arteries, your heart, and your brain the chance to balance themselves. I know what some of you are thinking. I've been doing this all my life and nothing has happened to me. That may be true, but age changes everything. What you could get away with at 30 or 40, you cannot always get away with at 60, 70, or 80. The body adapts less efficiently and the margin for error becomes much smaller. Why take the risk when prevention is so easy? Here's another thing to consider. When you jump up too fast, your heart is also under stress. The sudden demand for more blood flow forces it to work harder in an instant. If you already have underlying heart disease, maybe even without knowing it, that extra strain could be enough to trigger an arrhythmia, heart attack, or sudden cardiac arrest. So we're not just talking about stroke here, we're talking about protecting your entire cardiovascular system. And remember, this is not about fear, this is about awareness. When you know the truth about what's happening inside your body, you are empowered to make better choices. Don't ever underestimate the power of small, consistent habits. Slowing down for just 1 minute in the morning could save your life. Think of it like this. Your body is like an engine that's been parked all night in the cold. Would you turn it on and slam the accelerator right away? Of course not. You let it warm up, let the oil circulate, let everything come to life gradually. Your body works the same way. It needs time to transition from rest to activity, especially as you age. So my friends, please, the next time you wake up, remember this. Don't rush out of bed. Don't let the day pull you faster than your body is ready to go. Respect your heart. Respect your brain. Respect your circulation. By taking just a few moments to ease into your morning, you can lower your stroke risk, protect your health, and give yourself more years of vitality. Your health is your wealth, and every choice you make adds up. So let's start the day wisely. Slow down, breathe, hydrate, and move with intention. This small change can make the biggest difference in your life. I want to share with you one of the simplest yet most powerful routines you can practice every single morning to protect your health, especially if you're over the age of 60. This is something that costs nothing, takes just a minute or two of your time, and can make the difference between starting your day strong and safe or putting your brain and heart at unnecessary risk. I'm talking about how you get out of bed. Yes, the way you rise from sleep can determine whether your circulation stays balanced or whether you put yourself at risk of dizziness, falls, or even a stroke. You see, when we wake up, our bodies are in a delicate transition. For hours, we've been lying flat, our circulation is slowed, and our blood has been pooling in different areas of the body. Gravity hasn't been working against us, and our heart has been in a state of relative rest. When you suddenly go from lying down to standing, your body needs to make a quick adjustment. Your blood vessels must tighten, your heart rate needs to increase, and your brain needs steady oxygen. For someone younger, this process is fast, but as we age, those adjustments take longer. The blood vessels aren't as elastic, the nervous system isn't as sharp, and the heart doesn't pump as forcefully. That's why so many people over 60 feel dizzy, lightheaded, or unsteady when they get up too fast. But here's the truth. It doesn't have to be this way. By following a simple morning routine, you can ease your body into the day, protect your circulation, and dramatically lower your risk of something serious happening. Let me walk you through it. The first step is to simply pause when you wake up. Don't rush to sit up. Don't jump out of bed. Just lie there for a few moments. Take 3 to 5 slow, deep breaths. Fill your lungs with oxygen. As you inhale deeply, you're sending fresh oxygen into your bloodstream. As you exhale slowly, you're calming your nervous system and allowing your body to adjust. This alone begins to stabilize your circulation. Next, instead of sitting up straight away, roll gently onto your side. This small movement makes a huge difference because it allows blood to redistribute slowly rather than all at once. When you're on your side, bring your legs over the edge of the bed. Now instead of rushing to stand, just sit there. Sit on the edge of your bed with your feet on the floor, your hands resting on your thighs. Stay here for at least 30 to 60 seconds. During this time, your blood pressure has a chance to rise gradually, your blood vessels tighten where they need to, and your brain gets steady blood flow. Many people are surprised when I tell them that just sitting for that short period can be life-saving, but think about it. If you skip this step, your blood pressure may drop suddenly the moment you stand. That can cause you to feel faint, or worse, cause you to fall. For someone in their 60s, 70s, or beyond, a fall can lead to broken bones, a hip fracture, or a head injury. These injuries can take away independence and quality of life. And beyond falls, skipping this simple adjustment period can stress your heart and brain, triggering strokes or cardiac events. Now once you feel steady while sitting, you're ready to stand, but again, do it slowly, push yourself up gently, and once you're standing, pause for another few seconds, give your body time to confirm that it's balanced and stable. You may even want to hold on to the edge of the bed or a sturdy piece of furniture just as a precaution. Only after you feel steady should you begin walking. This entire routine, pause, breathe, roll to the side, sit, then stand, takes less than 2 minutes, but the benefits are enormous. You're reducing the stress on your cardiovascular system, protecting your brain from sudden drops in oxygen, and lowering your risk of falls. You're starting your day with balance and mindfulness instead of shock and strain. I also want to point out something very important here. For many people, mornings are when they first head to the bathroom. It's also when the urge to urinate is strongest after a night of sleep. Do you know that straining in the bathroom, especially right after standing up too quickly, has caused many strokes and heart attacks? The combination of a sudden posture change, dehydration, and straining is dangerous. But when you follow this gentle morning routine, you stabilize yourself before heading to the bathroom, you reduce the stress on your vessels, and you keep your circulation steady. And here's another benefit. This routine not only protects your body physically, but it also gives you a moment of mental clarity. Sitting on the edge of the bed, taking a breath, feeling gratitude for another day of life. It sets the tone for your entire day. Instead of rushing into stress, you enter the day calmly, mindfully, and with a sense of control. Some of you may say, "Doctor, I've been hopping out of bed quickly for decades and I've been fine," and I understand that. But as we age, what we once got away with is not always safe anymore. The arteries are stiffer, the nervous system is slower, and the risks are higher. I've seen far too many people who ignored these changes and suffered the consequences. Prevention is always easier than treatment, and this routine is one of the simplest forms of prevention you'll ever find. So my friends, I urge you, don't overlook this. Don't think it's too basic to matter. Sometimes the most powerful habits are the simplest ones. Just 2 minutes of patience in the morning can protect your heart, your brain, and your independence. That is priceless. Your health is your greatest wealth. Cherish it, protect it, and invest in it every single day. And remember, your mornings are not a race. They are an opportunity to begin your day with strength, balance, and peace. Treat your body with care, and it will reward you with more years of vitality and joy. I want to share something with you today that is so simple yet so powerful, and it can make a dramatic difference in your health, especially as you get older. When we talk about protecting the heart and the brain, there is one habit in the morning that can change everything. That habit is hydration, drinking water, first thing when you wake up. Now, you may have heard people say that you should drink water in the morning, but many don't realize how critical it really is, especially after the age of 60. Let me explain why this is so important. When you wake up in the morning, your body is in a dehydrated state. You've gone 6, 7, maybe even 8 hours without drinking a single drop of water. And while you've been sleeping, you've been losing water without even knowing it. Every breath you take releases water vapor. Every drop of sweat that evaporates during the night is fluid leaving your body. Even if you don't feel thirsty, you are dehydrated when you wake up. Now, what happens when the body is dehydrated? Your blood becomes thicker, more concentrated, and harder for the heart to pump. I want you to picture honey sitting in a jar. When it's thin, it flows easily. But when it's thick, it moves slowly and sluggishly. That's what your blood is like. First thing in the morning, thicker, stickier, and slower to circulate. And when your blood is thicker, the risk of clot formation goes up. Those clots can block an artery in your brain and cause a stroke, or they can block an artery in your heart and cause a heart attack. And here's something else. In the morning, the body naturally releases stress hormones like cortisol and adrenaline. These hormones raise blood pressure and tighten the blood vessels. Combine that with thicker blood from dehydration, and you have a dangerous recipe for vascular problems. This is exactly why strokes and heart attacks are so common in the early morning hours. But here's the good news. By drinking a glass of water, as soon as you wake up, you can change this entire scenario. That water begins thinning your blood almost immediately. It improves circulation, helps your heart pump more easily, and ensures that oxygen is delivered to your brain more effectively. You're essentially lubricating your entire cardiovascular system. You're giving your heart and brain the hydration they desperately need after a long night without it. Now, some of you may say, but doctor, I don't feel thirsty in the morning, and that's exactly the point. As we get older, the body's thirst mechanism becomes weaker. You may not feel thirsty, but that doesn't mean your body doesn't need water. In fact, older adults are much more prone to dehydration because they don't recognize the signs as quickly. This is why starting the day with water is not just a good idea, it's absolutely critical. I recommend that you keep a glass or a bottle of water right by your bedside. That way when you wake up, before you even start moving around, you can sip that water. Even 4 to 8 ounces is enough to make a huge difference. Of course, more is even better. Some people like to drink a full glass, about 12 to 16 ounces. The point is not the exact amount, but the habit itself. You're training your body to rehydrate at the most important time of the day. And let me tell you, this is not just about the heart and brain. Hydration in the morning has countless other benefits. It jumpstarts your metabolism. It helps flush out toxins that have built up during the night. It improves digestion, and it even supports healthy joints by keeping them lubricated. Your muscles function better, your energy levels increase, and your skin stays healthier. All of these things are connected to that simple morning glass of water. Now, many people ask me, can I have coffee or tea instead? Listen, coffee and tea are fine in moderation, but they should not be your first drink of the day. Both of them can act as mild diuretics, meaning they make you lose more water. And if you're already dehydrated in the morning, that can make the problem worse. So always drink water first. After that, if you want your coffee or tea, go ahead. But never let caffeine replace your hydration. Here's another tip. Adding a slice of lemon to your morning water can give you an extra boost. The vitamin C, potassium, and natural compounds in lemon can support your immune system, aid digestion, and help alkalize your body. But even plain clean water is enough to protect your circulation and reduce your risk of stroke. Think about it, my friends. How many people wake up and go straight to the bathroom, straight to the coffee pot, or straight to their busy routine without giving their body the water it needs? And how many of those same people suffer from strokes, heart attacks, dizziness, or fatigue in the morning? It's no coincidence. The body is crying out for hydration, and when we ignore it, we pay the price. I've seen patients who struggle with morning headaches, dizziness, and even high blood pressure, only to find that drinking water first thing in the morning dramatically improved their condition. It's that powerful. Now, I know this may sound too simple. People sometimes think it can't be that important, it's just water. But I promise you, the simplest things are often the most powerful. You don't need a fancy supplement or an expensive medication to protect your circulation in the morning. What you need is water. Clear, pure water. So my friends, I want you to make this a lifelong habit. Starting tomorrow, when you wake up, before you do anything else, drink water. Let that be your first act of self-care for the day. Do it consistently, and you will be protecting your heart, your brain, and your overall health in a way that no pill can match. Remember, your health is your wealth. It is the foundation for everything you do in life. Take care of it by honoring these small daily habits. Hydrate your body, and your body will thank you with more energy, better clarity, and a longer, healthier life. I want to leave you with one of the most important lessons you can ever learn about your health, and that is this: prevention is always better than cure. I say this over and over because it is the foundation of everything I teach. So many people wait until something goes wrong before they take their health seriously. They wait until after the stroke, after the heart attack, after the surgery, before they start thinking about what they could have done differently. But I'm here to tell you that the real power is not in reacting, it's in preventing. And prevention comes down to the small daily habits you choose to practice. Let's look at what we've been talking about. Jumping out of bed too quickly, skipping water in the morning, ignoring the body's need to transition slowly. These may all sound like little things, but when you add them up over weeks, months, and years, they have a tremendous impact on your health. Small habits are like seeds. Plant the right ones and you will grow a life of strength, energy, and longevity. Plant the wrong ones or neglect to plant anything at all, and you open the door to disease, weakness, and decline. Now, prevention is not about living in fear. It's not about worrying that every move you make is going to harm you. Prevention is about respect. Respecting the body that God has given you. Respecting the incredible systems inside of you that work every second of every day to keep you alive. Prevention means you take care of those systems so they can continue to take care of you. Think about this. Your heart beats about 100,000 times a day. Your lungs breathe more than 20,000 times a day. Your brain is firing millions of signals every single second. These organs are working tirelessly to keep you alive. Doesn't it make sense to give them the best chance of succeeding? That's what prevention is all about. I've had so many patients over the years who came to me after something went wrong. They would say, "Doctor, I wish I had listened earlier. I wish I had taken better care of myself. I wish I had made those changes before it was too late." And the truth is, in many cases, the damage could have been avoided with simple preventive steps. That is why I'm so passionate about teaching you this now before something happens. When you prevent, you are not just avoiding disease, you are investing in your quality of life. Think about the difference between living into your 70s, 80s, or even 90s with strength, balance, and independence versus spending those years in and out of hospitals, dependent on medications, or needing constant care. Prevention is what determines which of those paths you take. And prevention is not complicated. It's not about extreme diets or expensive supplements or long, painful workouts. It's about simple, consistent habits practiced every day. Wake up slowly, drink your water, move your body, eat nourishing foods, practice gratitude, and reduce stress. These little things don't take much time, but they add years to your life and life to your years. Let's take the example of stroke. Most people see it as something sudden, something unpredictable, but in reality, strokes are often the result of years of buildup, arteries narrowing, blood pressure rising, circulation weakening. Prevention means you address those issues long before they reach the point of crisis. You lower your blood pressure naturally through lifestyle. You keep your circulation healthy by moving your body daily, and you keep your blood thin and flowing with hydration and nutrition. That is how you prevent. And here's something powerful to remember. The body has an amazing ability to heal itself if you give it the right environment. Even if you've already made mistakes, even if you've been neglecting your health for years, it's never too late to start. Prevention doesn't only belong to the young. Prevention belongs to anyone who chooses to change today. The body is resilient, and it will reward you for every positive step you take. Now, I know some of you may feel discouraged. You may be thinking, "Doctor, I've already been diagnosed with high blood pressure or diabetes, or I've already had a stroke." And I want to encourage you, prevention still applies to you. You may not be able to undo everything, but you can still prevent things from getting worse. You can still prevent another stroke, another heart attack, another fall. Every choice you make still matters. This is why I say prevention is not a one-time act, it's a lifestyle. It's something you do every day, not because you have to, but because you love yourself enough to do it. When you take care of yourself, you are also taking care of your family, your friends, and everyone who loves you. Because when you are healthy, you can give more, you can live more, and you can be there for the people who count on you. So my friends, start with the simple things. Don't underestimate them. Wake up slowly, drink your water, move with intention, eat foods that nourish your body, and manage your stress with calmness and gratitude. These are not difficult, but they are powerful. And when practiced consistently, they prevent disease, they protect your brain and heart, and they allow you to live a longer, healthier, and more fulfilling life. Always remember this truth: your health is your wealth. You can have all the money, success, and possessions in the world, but without health, none of it matters. Prevention is how you protect that wealth. Prevention is how you hold on to the greatest treasure you will ever have, your life. So today I encourage you to take prevention seriously, make it a priority, practice it with love, with consistency, and with faith, because prevention is not just about adding years to your life, it's about adding life to your years.